Suboxone sublingual film administration instructions. Suboxone film is a combination of buprenorphine and naloxone indicated for maintenance treatment of opioid dependence. It is a sublingual medication, which means that it is absorbed through the veins under the tongue. Before taking Suboxone film, drink some water to moisten your mouth. This will help Suboxone films dissolve more easily. To open your medication package, fold along the dotted line and tear down at the slit, or use scissors to cut along the arrow. Making sure your hands are dry, use 2 fingers, grasp the outside edge of the Suboxone film, and remove it from the package. If your dose is 1 Suboxone film, place it under your tongue, close to the base on the right or left side. If you are directed to use 2 Suboxone films, place the other Suboxone film under your tongue on the opposite side. Try to avoid having the Suboxone films touch as much as possible. Keep the Suboxone films in place until they are completely dissolved. If you are directed to use a 3rd Suboxone film, place it under your tongue on either side after the first 2 have dissolved. While Suboxone films are dissolving, don't chew, swallow, or drink water because they will not work as well. Make sure your friends and family are aware that you shouldn't talk when the Suboxone films are dissolving, because this can interfere with how it is absorbed. Always take Suboxone film exactly as prescribed by your doctor. Important safety information. Suboxone, buprenorphine, and naloxone sublingual film C3 is indicated for maintenance treatment of opioid dependence as part of a complete treatment plan to include counseling and psychosocial support. Treatment should be initiated under the direction of physicians qualified under the Drug Addiction Treatment Act. Suboxone sublingual film should not be used by patients hypersensitive to buprenorphine or naloxone. Suboxone sublingual film can be abused in a manner similar to other opioids, legal or illicit. Clinical monitoring appropriate to the patient's level of stability is essential. Chronic use of buprenorphine can cause physical dependence. A sudden or rapid decrease in dose may result in an opioid withdrawal syndrome that is typically milder than seen with full agonists and may be delayed in onset. Suboxone sublingual film can cause serious life-threatening respiratory depression and death, particularly when taken by the intravenous IV route in combination with benzodiazepines or other central nervous system CNS depressants, such as sedatives, tranquilizers, or alcohol. It is extremely dangerous to self-administer non-prescribed benzodiazepines or other CNS depressants while taking Suboxone sublingual film. Dose reduction of CNS depressants, Suboxone sublingual film, or both, when both are being taken, should be considered. Liver function should be monitored before and during treatment. Death has been reported in non-tolerant, non-dependent individuals, especially in the presence of CNS depressants. Children who take Suboxone sublingual film can have severe, possibly fatal respiratory depression. Emergency medical care is critical. Keep Suboxone sublingual film out of the sight and reach of children. Intravenous misuse or taking Suboxone sublingual film before the effects of full agonist opioids, for example heroin, hydrocodone, methadone, morphine, oxycodone, have subsided, is highly likely to cause opioid withdrawal symptoms. Neonatal withdrawal has been reported. Use of Suboxone sublingual film in pregnant women or during breastfeeding should only be considered if the potential benefit justifies the potential risk. Caution should be exercised when driving vehicles or operating hazardous machinery, especially during dose adjustment. Adverse events commonly observed with the sublingual administration of Suboxone sublingual film are numb mouth, sore tongue, redness of the mouth, headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, swelling of the limbs, disturbance of attention, palpitations, and blurred vision. Cytolytic hepatitis, jaundice, and allergic reactions, including anaphylactic shock, have been reported. This is not a complete list of potential adverse events associated with Suboxone sublingual film. Please see full product information for a complete list. To report an adverse event associated with taking Suboxone sublingual film, please call 1-877-782-6966. You are encouraged to report adverse events of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.